Hi, my name is Helena Tacoma and I'm going to talk about allocating organs to cognitively impaired patients. Definition: transplantation for people with cognitive impairments is still debated. In a new AAP policy statement titled Children with Intellectual and Developmental Disabilities as Organ Transplant Recipients, included in the May 2020 issue of Pediatrics, it cautions that this exclusion of children with intellectual and developmental disabilities must end. Children with intellectual and developmental disabilities, which are often defined as an EQ of 70 or less, should be evaluated for organ transplants in the same way as children without disabilities. Applications in medicine. United Network for Organ Sharing requires transplant centers to submit data on the cognitive development of all transplant candidates to allow retrospective risk factor analysis of outcomes. A study of 25 cognitively impaired patients who underwent kidney transplantation report that all people providing primary support were satisfied with the transplant and believed that their quality of life improved. However, surveying 88 transplant centers in the United States found that 85% of pediatric transplant centers consider neurodevelopmental status as an eligibility factor. Pros and cons. Pros. Transplantation of patients with disabilities has the potential to improve cognitive function. Transplantations improve the cognitive quality of life of patients with disabilities. Cons. Transplantation for people with cognitive impairment poses significant logistical and ethical challenges. Transplant centers are not responsible for your decisions, as they have the appropriate primary authority to accept or reject patients on their waiting list.
Every year, many thousands of people receive the gift of life, a life-saving transplant of a heart, kidney, liver, lungs, pancreas, or intestines. And thousands more people receive corneas and other tissues that restore sight and health. Transplantation is one of the great medical advances of our time. How does it work? It all starts when someone's organ begins to fail, and that person will need a transplant to survive. A thorough evaluation is conducted at a transplant center, and if the person's a good candidate for a transplant, he or she will be put on the National Transplant Waiting List. Once a person is on the list, the wait for an organ begins. A national system matches people on the waiting list with donors. The factors considered in matching donors and recipients include blood type and body size, how sick the patient is, distance from the donor, tissue type, and length of time on the waiting list. What doesn't get taken into account? Organs are never matched based on race or gender. Income, celebrity, and social status are also never considered in matching donor organs to waiting patients. There's no telling how long the wait will take. In fact, some people don't receive an organ in time because the waiting list is very long and there aren't enough donors available. That's why an average of 20 people on the waiting list die each day. Imagine how many we could save if we all were donors. Most organs for transplants come from deceased donors. Here's how that happens. A person comes to the hospital with a life-threatening brain injury, such as from an accident, a stroke, or lack of oxygen. The doctors work hard to save the patient's life, but sometimes nothing can be done. There's a complete, irreversible loss of brain function. The patient is clinically and legally dead. That's when being a donor can turn a time of loss into a time of hope. Because machines have kept blood containing oxygen flowing to the organs, they can be passed along. One person can give life to as many as 8 people through organ donation and enhance the lives of 50 people or more through eye and tissue donation.
Issue plated in Ecuador. In Ecuador, the allocation of organs, tissues, and cells corresponds to INDOT, which will issue the regulations on the technical allocation criteria for each organ, tissues, and cells, taking into account the following parameters. First, patients declared in Code 0 will become priority cases. Second, respect for the principle of best interest of girls and boys, minors, and conditions of double vulnerability. Third, adequate technical, ethical, and scientific scale. Conclusion. The policy states that denying organ transplants to people with disabilities is unethical and could constitute illegal and unjustified discrimination. For this reason, transplant teams must take into account both the cognitive and adaptive skills of the patients to determine if a transplant might be beneficial, but children without disabilities have no more right to an organ transplant than children with disabilities. Thanks.